We've had an alarming case of children who are currently having symptoms of diarrhea. Cholera has been ruled out because they've been checked and there's been found that it is negative for cholera. However, we have all indications that this is the Rota virus. As early as about an hour ago, we've already confirmed 3 cases of those that have already been tested that it is actually Rota virus. We currently have enough dosages. The Public Health Department will immediately engage the community health workers, volunteers on a stipend basis between now up to the end of this financial year, where the next financial year we are now going to be getting this as a conditional grant from the national government. The Coast General Teaching and Referral Hospital will immediately employ 54 personnel from medical officers to the nurses, to the lab technicians, to the pharmacists as well. The Department of Water, together with the Public Health, will begin distribution of chlorination pots for all the boreholes and wells. I'm giving an extra emphasis to the Department of Lands. The medical terminology on how this virus is spread is actually fecal oral, which means it comes from extract of stool up to your hand and into the mouth through water. And this is the reason why when the county government is going to take action, as it has done before, by locking people in, you need to understand the consequences of your action. We have done this before, and we're not going to stop, and we're not going to relent. We need to ensure that we do not have such kind of contaminations. The Public Health Department, together with the Education Department, will ensure that we will check with a view of regularizing, and in the event that hygiene levels of any ECD or daycare center, be it from the slums, be it from the private sector, be it from the public sector, if the health standards are not met, then an immediate closure on those daycare centers and ECDs. But the first priority will be to regularize these particular entities. And lastly, the Trade Department, to ensure that those areas where we have people who are handling food, there should be enough water, and we should be having hand washing stations. I appeal again to everyone, especially those with children below the months of 18. I'll personally be conducting a sensitization campaign to be going out so that we can be able to vaccinate these children against the Rota virus. It is better to be vaccinated than to lose a life. At the same time, we are asking, let us go back to being extremely hygienic. We need to ensure that we wash our hands. For those who are actually food sellers, you need to constantly wash your hands because you receive money. The money could have been contaminated and you're holding food, and the food is then passed on, and we end up having to see children being the victims out of this. So we're asking everyone to follow those set health protocols for everyone's good. The problem that we are currently facing is we do not have enough supply, especially the one from Zima. There's been a lot of issues that are going on, issues to do with climate change, water supply reduction. And one of the issues that we are going to be doing is figuring out of getting water from our own borehole that we have in Tiwi that is going to be revamped, that is going to see at least parts of Likoni get more water, and also ensure that the line that was bringing water from Zima into town is immediately revamped. But yes, I'm aware that there's a shortage of water. I live here. Majority of the cases are actually, and the origin of this is actually Kisauni constituency. So that is where it has, and we're seeing that it has actually originated from Kisauni, and it is being attributed as well to a daycare center from Shomoroni area. We've had, yes, I'm aware.
Mambo. Achukua tamu.